Thank you, Shane. And Tom, thanks for asking that question. 2022 will give me a couple of years to be able to sew the Mountaineer opposite my Panther, if you know what I mean. You guys get that, because I'm from Pitt, obviously. But I'm an adopted Mountaineer and one by choice, which will be fun. But that'll be really hard for me. I'll be torn by them. Okay, the last of our plenary session speakers this morning before we send you out at 10:30 for your breakout sessions is none other than our Clay Marsh, who also just finished his first year with us, which is pretty exciting. And that's really, really great. And hold on to those of you who love sugar, because, you know, Dr. Marsh is going to tell us something about some of these things about being healthy. He is a Charleston native, one of our native sons, and he's also a two-time WVU alumnus. Dr. Marsh took over as our new leader of West Virginia University's academic healthcare operations just about last year. He's vice president and executive dean for health sciences. In this role, Clay oversees 5 schools of our West Virginia University Robert Byrd Health Sciences Center: dentistry, nursing, medicine, pharmacy, public health, as well as numerous allied health programs and clinical operations across the entire state. He's a nationally renowned leader in medicine, especially as it relates to pulmonary and critical care medicine. And he served many roles at The Ohio State University after receiving his biology and medical degrees from here. At OSU, at the Wexner Medical Center, Dr. Marsh served as executive director of the IDEA Studio for Healthcare and Design. He was the chief innovation officer and professor of internal medicine in the division of pulmonary, allergy, critical care, and sleep medicine. He's devoted his professional life in personalized healthcare, which is fabulous, where he marries high-tech systems with high-touch care to augment health and to help treat disease. He's a member of numerous professional medical organizations. He's award-winning. He's had national grants in research, teaching, and many, many honors. And folks, you will be very inspired by him. Ladies and gentlemen, please welcome Dr. Clay Marsh to the podium.
Thanks, Cindy. I'm coming down to join you guys. So, how many of you guys have a personal doctor? How many of you guys like your personal doctor? How many of you guys like to go see your personal doctor? Well, so we don't want to get sick. We want to be healthy. So what I'm going to tell you about in the next 10 to 15 minutes is about some thoughts about how to be healthy. And I'm going to give you guys the punchline first. So the punchline is, I would recommend you eat different, you exercise regularly, and you be grateful. You do those 3 things, you're going to live a long time and live very well. So to start off with, though, Gordon was telling a lot of great stories, so I got to tell my short story. So one of the real treats for me in coming back to WVU and to West Virginia was going to the State Fair. So I go to the State Fair with Gordon and Michael Garcia, the Mountaineer, and a bunch of other people. And of course, everybody's flocking around Gordon, flocking around the Mountaineer, and they're handing me their phones to take pictures of. So I'm taking picture after picture after picture. And somebody finally goes, "So, what do you do there?" I said, "I'm the photographer." So one of the things that Gordon said, which I think is really important, so you know that West Virginia has some financial challenges. And we believe that the real 3 legs of the stool that we want to do for the state of West Virginia is health, economic growth, prosperity, and education. And one of the challenges that West Virginia has is opposed to national averages where we spend about 18% of our gross domestic product on healthcare. West Virginia spends about 26% of its GDP on healthcare. So one of the real opportunities for us in West Virginia to be able to reinvest money in jobs and education is to reduce our spend in healthcare. And not only do we spend one of the most in the country, but if you look at a Gallup poll and you look at well-being as an estimate of not only how people feel about their health, but how people feel about their life, how people feel about hope, we are dead last. Simon Sinek, who is a great speaker, wrote a book called Start With Why and did a TED Talk on the Golden Circle. And he said that instead of starting at an organizational or personal level with what you do, how you do it, and going to why you do it last, you should start with why. You should start with your purpose. And my purpose coming back to West Virginia, I would have said, was to improve the health of people in the state of West Virginia. But today, I would say our goal as a team is to improve the well-being of the state of West Virginia, providing not just health, but providing hope. And if we do that, I believe we can change the future of our state. So we have come up with this paradigm in 3 pillars. Our 3 pillars are, we want to help people stay well, which to me is the purpose of medicine, right? None of us want to get sick. But we know that people are sick in our country and are sick in our state. And in fact, the business of medicine is to rescue from failure. So we make money when people are sick. And eventually, the right system has to tie together the well care and the sick care, because you need to stay well. But if you get sick, we need to have great medical care for you. And that's what we're trying to do in the state. And the way you do that is you create collaboration. So instead of us versus Marshall, us versus CAMC, us versus Mongen, it's all of us together. And it's not only all of us together on the healthcare delivery side, but it's all of us together on the community health side too. I'm going to tell you a great story at the very end about what's happening in Williamson, West Virginia, in the really deep confines of the coal country. And also what's going on in the southern part of the state and other places. We're in Clarksburg. Recently, and this is apropos for Cindy, we have recruited some really great people. And one of the people we've recruited to run some of these really select programs, which we call signature programs, which are programs where we really want to provide tertiary and quaternary care, is a gentleman named Phil Saul. Phil was the chair of pediatrics at Nationwide Children's Hospital in Columbus, friend of mine, and we plucked him to run the children and the women's services at West Virginia University. And most recently, you may have read in the paper that we recruited a triad, 3 of the leading heart surgeons from the University of Pittsburgh Medical Center. And let me just say that when they first came into their leadership and said they're going to WVU, somebody said, why would you go to WVU? Nobody even knows where it is. Well, today, they know where we are. So Bill Banyan said, as long as they root for WVU in the pick game, it's good. And so they've committed to me they would. And then we want to look at big ideas in healthcare, solve big problems. And the 3 problems that we have picked are opioid addiction and preventable drug overdose. Today, more people die of opioid overdose deaths than car accidents in our country. That is crazy. 80% from prescription drugs, and also obesity and elderly health and elderly care. So what defines the well-being of the population? Well, this is an old hierarchy done by Abraham Maslow, his triangle. And at the base is physiological. This is really how people gain health and well-being and hope. Next is safety, which is really, it says security of body, of employment, of the family, of health, of property. And then love and belonging, esteem and self-actualization. I think much of our state is stuck here. And part of the problem is, for us to improve the health of our state, we have to improve the hope of our state. So I got my epiphany when I had the opportunity to talk to a group of Navy SEALs. And I had my white coat on, and I was talking to them, and I said, you guys are America's best and brightest, and you're really healthy. And one of the guys' hands raised up, and I'm sitting there going, what did they not understand about what I just said? I was literally 15 seconds in. I'm thinking to myself, maybe not the smartest people. But of course, it was me that wasn't so smart, because they said to me, Doc, I just want to make sure you understand, we're really fit, we're not really healthy. We have high cholesterol, high blood pressure, we do really risky activity, we drink a lot. When we're deployed, our days and nights get inverted for months at a time. We're really fit, we're not really healthy. And it made me think, what is health? And instead of going through what do you guys think health is, my sort of idea about health has become that health is having your biological age be less than your chronological age. In other words, being young older versus being old younger. And I'm going to talk about the things that might be able to help you be young older. So what determines longevity? So I understand here in Naples, there are a group of people that are interested in creating the blue zones. And the blue zones are 5 places in the world where people live extraordinarily long and live well. So of course, we want to know what are those secrets. And it turns out this is not rocket science or gravitational Einstein's theory of relativity stuff. It's pretty common sense. So what it is people in these areas, they exercise more. And it's not like they go to the gym, they don't run marathons, they just get out, they have fun, they play. They enjoy walking places, riding places, swimming. So they get 4 extra years for exercising more. Having the right outlook, understanding what's really important. Working to live, not living to work. Making sure that you have your priorities. Gratitude, 4 years for that. Eating turns out to be the most influential thing as far as the prediction you can do related to the blue zones, and that is 80% of what we eat in the United States, eating more plants, a Mediterranean kind of diet, and having a glass of wine or 2 a day. So the last part, that's a good thing, I think. And you get 8 years for that. And then having the right tribe. So having the right connections and community. And I'm going to talk more about that. So let me talk to start off with gratitude. And I think gratitude's important. And there's a study that was done by Elizabeth Blackburn, this lady here. She did something pretty good. Does anybody know what she did? She won a certain prize. Nobel Prize. Yeah, that's pretty good. And she won it because she figured out that at the end of our chromosomes, our genetic material, there was parts that the longer they are, called telomeres, the longer you live. And the shorter they are, they can predict how old you are, the biological age. And Alyssa Appel is a psychologist that worked with Elizabeth Blackburn in San Francisco. And they studied moms that had chronically ill children. And they asked the moms if they felt stressed or not. And some of the moms felt stressed, and some of the moms felt grateful. The moms that felt stressed, they measured their cells versus their peers. And what did they find? Those moms were what? They were older. Those moms were older. So if you felt stressed and you had things that were stressful, then you age more. And that may not be any real mystery to people. You know, look at President Obama, look at some of the other people in high-stress jobs. But Kelly McGonigal looked at the other side of this. So what happens if you look at the people that had the same stress but felt grateful? So if you measured their cells, guess what happened? Nothing. Nothing. They had no evidence of shorter telomeres, no evidence of aging. So the point is, it's not what's happening to you, it's how you see it. And one reason why, to me, gratitude is so powerful, because instead of looking at things as problems, we look at things as opportunities to grow. Because that is how we grow, is facing things that are difficult. Steve Horvath is a guy that we've worked with a little bit, and he is a really interesting guy at UCLA. He's the head of bioinformatics. Sorry. Yeah, no problem. Yeah. So anyway, Steve Horvath's at UCLA, and so he has come up with a mathematical formula to be able to predict how biologically old people are by looking at wear and tear marks called methylation marks on their DNA. So kind of like rings of the trunk of a tree where you can tell how old the tree is, that he can count how many areas of the DNA you have these methylation marks, and he can predict your age within 3 years. So that's pretty interesting. But then what he did is he went and looked at a cancer database. He looked at breast cancer tissue. And what he looked at was, he looked at the age of the women, and then he used his mathematical formula to look at their cancers. And he found that the average age of the breast cancer versus the age of the women, the breast cancer was 36 years older. And what's really interesting about that is that part of the way that each cell knows where to go, like which cell to be a liver cell, a lung cell, a heart cell, is these methylation marks. It's like it gives you an instruction manual for each cell. And so it could be that what's happening is part of our bodies are aging faster than the rest, and maybe those are the part of our bodies that are really more susceptible to cancer and to other things. So maybe we can start to read that and then intervene, because there's drugs and diet and other things that we can do to try to reverse that. So food. So I am an advocate of reducing sugar. And the reason why I'm an advocate of reducing sugar is the average American, that means you guys, eats this much sugar per person per year. It's buried in everything. And sugar is really important because there's only one thing across all species environmentally you can do to live longer. And that one thing is fewer calories. Fewer calories. And we know that the obesity epidemic started in about 1960s, and Gary Taubes, a friend of mine who we'll bring to Morgantown, he's in California, wrote this book, went out and looked at all of the research on obesity, and the obesity epidemic started in 1960 when the USDA came out with the what kind of guidelines? Low fat. Low fat guidelines, so we have three types of food. We have proteins, carbohydrates, and fat. Proteins are pretty fixed in most people's diets, so if you eat less fat, you eat more carbs. And more carbs are really what? More sugar. Sugar. And it turns out also that the pathway to extend life is downstream of the insulin receptor, which is activated by sugar. So not only does sugar, in my opinion, cause obesity, it probably causes aging. And it may not only cause aging for you, but you might hand that down to your kids and their kids, which might make their life shorter. So I think the most important single thing that I'm going to share with you guys to think about doing is trying to watch sugar. So anything white, bread, desserts, the things that we love because we're addicted to sugar, that if you cut out. So I've done that, and I've walked, and I'll talk about that in a minute, and I've lost 20 pounds. I haven't done anything else. I haven't tried to diet. Lower sugar and exercise. Exercise, so it turns out I'm addicted to my Fitbit, which I have in my pocket. And there is data suggesting if you do eat sugar, and this is in younger people, but you walk 12,000 steps, then that sort of interferes with the activity of the insulin receptor. So even if you're going to eat sugar, exercise. And exercise is good for you not only to lose weight, it's really good for you as far as your cardiovascular health, your brain. You think better, you reduce your risk of Alzheimer's, et cetera, by exercising. And you don't have to exercise like crazy. It turns out that if you just exercise consistently and walk, that's good. 150 minutes a week of walking is great for you. And you don't get that much more benefit if you go out and try to run, et cetera. One thing that's really interesting, the best longevity studies, the studies that have looked at people over a real long period of time, they found that it wasn't smoking and obesity that predicted, that were the risk factors for keeping you from predictably living a long time. They found these things. They found that people that really lived a long time had a more love in their life, and they had a higher sense of well-being. They had purpose. Purpose is really important across these. They were connected to people, and they had a mindset of gratitude. So again, eat less sugar, walk more steps, have more gratitude, and likely you're going to live a long time. Ikigai is a term in Okinawa that basically means the reason for being, the reason for getting up. Gratitude is the highest place you can be on your emotional ladder, that basically instead of looking at things as problems, look at things as grateful. You remember Simple Gifts is a song that we like at West Virginia University, and the average lottery winner is less happy than the average person. The average person surviving a life-threatening illness is happier than the average person. Understanding these gifts that we have to be independent, to see the people we love, to do the things that we choose to do, that is a greater blessing than all the money you can get. Connection's real important. Nick Christakis looked at a really famous study called the Framingham Heart Study Database, where we got all of our statistics about the things that were responsible for heart disease, family history, smoking, et cetera. Found out you're more likely to be obese if a person you identified as a friend was obese than if a first-degree family member was obese. About 60% likely friend, about 40% likely family member, but if that person also identified you as a friend, your risk of becoming obese went up by over 100%. So it's who you hang out with that really matters. And in fact, the Longevity Project, one of those studies said that the two most important things in living a long time, staying connected to purpose, staying connected to people. This is really powerful though. So education. So it turns out that if you are a Latino woman who is poorly educated and you give birth to a baby girl, that baby girl's telomeres are shorter than other babies. That baby's life is likely to be shorter genetically at the time they're born. In addition, there's a really good study on economic development and education that says an additional 4 years of education lowers mortality by almost 2%. So education has a direct impact and prediction on your lifespan and your longevity. And I'm going to finish with a story. So Dino Beckett, student body president, West Virginia University, applied to our medical school, and what did we do? We turned him down. But he went to Lewisburg and went to the School of Osteopathic Medicine, and he has done the most amazing work. Let me just tell you real quick about his story. And we're working with Dino now, and he's helping us in the southern part of the state. So Dino goes back to Williamson, where he's from, coal country. He's a family medicine guy. He buys a couple of places, he fixes them up, he paints some of the lamp posts that haven't been painted in a long time to beautify things, let people know he's there to stay, starts a practice, sees a bunch of people, they can't really pay, so his practice is kind of going underwater. And a woman from Santa Fe comes and who's a grant writer, comes and helps him. He becomes a federally qualified health center. He figures out they don't have fresh food there, so he starts a community garden. People don't have access. He starts a mobile market. People aren't exercising. He gets a kid that loves to run, starts a running club, starts a walk and lunch with all the people competing business-wise in Williamson. They put a map up of West Virginia because they're going to virtually walk across the state. In a month, the first team has already walked across the state. Put a map of the United States up. The winning team walks virtually to Los Angeles, Marin County, California. San Francisco finds out about this. Marin County is now walking to Williamson. Oh my gosh. Dino Beckett with his friend gets a Center for Medicaid, Medicare Services Innovation grant, $2.2 million, hires community health workers, takes a worse diabetic, makes them better. In 2014, Dino Beckett and Williamson were chosen as one of 6 Robert Wood Johnson Culture of Health winners in this country. If it can be done there, and what we would say is instead of making health viral, first we have to make hope viral in our state. So I'm happy taking questions. Please. Truvia. Okay, so now we're getting down to specifics. So the question is, if you don't want to eat sugar, what should you eat? And in fact, that is the substitute that the people that I like. So Truvia is from a plant. This is stevia. And so that is the best substitute for sugar. It turns out, though, there's a guy that we're working with, a guy named Evan Siegel, who's at the Weizmann Institute in Israel. And he's figured out that artificial sweeteners, particularly ones that aren't Truvia, can still make you gain weight because it changes your gut bacteria. And he can now, and we're going to bring this program to Morgantown, is he can now predict from your gut bacteria how you're going to respond to certain foods. So different people respond differently. Some foods spike your blood sugar and some don't. And so we're starting to work with them to try to bring this to the more popular markets. But that's the right way to go. Other questions? Woody?
It seems to me that one of West Virginia's plagues has been our lack of self-esteem.
Absolutely.
You can eat less, you can walk more. How do you really impact self-esteem?
Yeah, I think that's really, really important. And if you look at that was really what I was trying to get at. If you look at Maslow's hierarchy, I think the key is if you look at a married couple and you're doing marriage counseling, and the couple are arguing with each other, well, there's hope for them. But if one person dismisses the other person, there's no hope. It's done. And I think particularly for people, you know, me coming back to West Virginia, I think in general, in many ways was to pick up the torch from my dad, who was the editor of the Charleston Gazette, and he really stood to try to help people that were more vulnerable. And I think the key, Woody, in my opinion, is that it's not what we do, it's the fact that we're there, and we care, and we're not going away, and we are going to help people in whatever way we can and help communities, just like Dino did. And so we're trying to identify community leaders. We want to support them. We want to help them help their own communities. We need to come up with ways to help people find purpose and meaning. And we're starting some mentorship programs so that we can at least give people a reason to get up in the morning. But this is truly, as Lotzi said, the journey of 1,000 miles, which starts with a single step. And I would say we've made several steps already, but we have a whole long way to go. But I think the key is that we recognize, at least I believe, that is the problem, and the problem won't solve immediately, but if we're there and committed and working together, so it's not us versus somebody, it's us with. And so we're trying to connect all of these bright spots together, like Dino and Williamson. We're in Logan, Gary White, Earl Ray Tomlin. We're in Boone County with Ron Stallings, and we're helping the prosecuting attorney with the heroin epidemic they have. We're in Harrison County. I mean, so we have the Brick Brothers out there. We have Larry Rhodes. There's a lot of good things going on, but I think that what we're finding is we're all starting to come together. And if we can come together and collaborate and all focus on the same end goal of improving the well-being and improving the lives of the people of our state, I think we'll be fine. Bill.
Well, you just mentioned the heroin and opioid epidemic in the state. And it's not just related to the southern part of the state. Now it's in the eastern panhandle, it's the northern panhandle. What are you trying to do, or what programs or initiatives can you put in place to help that major epidemic in the state?
Yeah, that's a great question. And in fact, when I started and went to visit with President Gee, our Washington representatives, that's all they want to know. What are you going to do about the opioid problem? So we have two programs that we've married together, and then I'll talk very briefly about some of the other things. The two programs we've married together, we are only one of 10 places in the country to have a grant from the Center for Disease Control called the Injury Control Center. And the Injury Control Center is really focused at preventing reversible deaths from injuries and accidents. And it turns out today, as I said, opioid overdose #1. So we're taking that group and we're training first responders to be able to give Narcan. In fact, we've already saved probably 10 to 15 people's lives doing that. We are lobbying for the policy of giving Narcan over the counter, of expanding the ability of physicians to use certain drugs to reduce the response of withdrawing from these pills, so it makes it easier for people to stop. And we're starting to look at control measures as far as prescribing habits and education policies, et cetera. We're marrying that program with a program that we call the COAT program, which is the Comprehensive Opioid Addiction and Treatment Program started by Raleigh Sullivan, which is our treatment program, which is really about not only the treatment with the drugs to reduce the withdrawal symptoms, but also individual and group counseling and the 12-step program like Alcoholics Anonymous, which is mentoring, et cetera. And by doing that, we're going to expand access to that, which will help more West Virginians. But the real deal is we need to prevent it before it starts. And I think that, again, the frame of, so it turns out that the data says that people that are richer actually try drugs more frequently than people that are poor, but they almost always stop. And people that are poor, when they start, don't stop as much. And we know that basically these drugs are very addictive, but if your life is not good, if you have no reason to get up, if you have no hope, if you have no community, then I think it becomes easier just to stay on these drugs. So we're really doing a lot of work, prevention in schools and trying to get target areas. But also I think this idea about putting people to work, helping people get educated. Joyce can talk more about this than me, but that is really our role. Our role is not to be West Virginia University, the insular place on the hill in Morgantown. Our role is to be what a land-grant university should be. President Lincoln's vision of a land-grant university, which is really service to our state. And I believe if we do that right, lots will get better. Thank you for your question, though. Okay. Back to Cindy. Thank you, guys.